Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. Today we're talking about oral chemotherapy.
Oral chemotherapy was developed as a way to take our traditional, the IV agents that you get through fluid coming into the clinic, getting long infusions that could take up to 6 to 8 hours, and putting it in a pill form. It could be a capsule, it could be a tablet, to make it easier for patients to take these things at home. And not have to go through the process of getting IV lines put in, being stuck by needles frequently.
Who does the chemotherapy counseling service provide services for?
The service is available to any adult patient who's seen at the UMass Cancer Center. It doesn't matter if you fill through another pharmacy or not.
Do you need a referral?
No, you don't. Sometimes the providers will tell patients that they can contact us, or the pharmacy will tell them they can contact us. We also try to give our business card out with any prescription that's filled through our pharmacy here.
How does the counseling service work?
It works whatever way is best for the patient or the caretaker. Oftentimes we make phone calls because it's convenient for people to stay at home, and we can talk to you over the phone. Sometimes people like to see us in person. We can set up a time during an infusion or an appointment with your provider, with a doctor, while you're here, and talk to you in person as well.
What is the role of a counselor in assisting a cancer patient who uses oral chemotherapy?
So we talk to patients about the medication itself, how to handle it. There's special precautions you have to take with chemo at home. You can't just throw it away in the trash. How to manage their schedules if they need a calendar, or how to put a calendar in their phone to stay on time, and then what side effects to look out for, when they should call, or maybe when they need to go to the emergency room.
How important is counseling for a patient who takes oral chemotherapy?
It's important because when patients got chemotherapy here at the hospital or in the clinic, you have nurses, pharmacists, physicians who are monitoring you and making sure everything's going okay. But when you get an oral pill and you go home, it's up to the family and the patient themselves to kind of make sure everything's going okay. So it's really important that they understand the medication, what it can cause, and how to give it safely.
What benefits does oral chemotherapy give cancer patients? Are there any drawbacks?
It can go two ways. Sometimes it's more convenient for patients, especially when we have patients who travel from far away to come to UMass to get treatment. But it can also be a little bit more difficult. There's some weird scheduling with oral chemos where it's not taken every day. It could be multiple times in a day. So there's convenience, but it can also be a little complicated as well. Some medications have to be taken without food, some with food. Some have special requirements of how much food you can take at the time of the medication. So there's a lot of counseling about how to give it, what time to give it, and if there's other medications that the patient is taking that interact with that drug, how to time those medications as well.